Well, good afternoon, everyone. Welcome to our Fireside Chat. Today's topic is creating healing spaces, a conversation with Dr. Esther Sternberg. My name is Lance Kirk, and I'm a principal at LGA Architecture, and I will be your moderator for this afternoon. As many of you know, LGA is dedicated to helping our clients and our community live and work environments that enhance their quality of life and create positive, memorable experiences. To this end, LGA has been conducting a series of what we call the Fireside Chats with very knowledgeable professionals who have been helping us all better understand how to optimize the investments we all make in our natural and built environments and ourselves. In that tradition, we've invited Esther Sternberg, the deeply experienced and knowledgeable professional about creating healing spaces. But before Jason introduces Esther, I'd like to go over a few kind of webinar logistics here. So everyone is muted now, their cameras are off, but we ask you to direct your questions to the Q&A section. We'll be monitoring throughout the afternoon and give you an opportunity to have Esther answer your questions. We're also recording this chat, which will be available on our webinar's webpage in a few days. All attendees will also receive an email with a link to the recording. And additionally, all of our Fireside Chats are on our website as well, on our webinars page. So you can go there to see all the past 11 webinars we've been doing over the last 13 months. So please let us know what you think of these webinars and the Fireside Chats. You can reach us on our social media outlets, our email, and our contacts page on our website. And lastly, we're in the middle of sending out copies of the Healing Spaces book to the first 20 registrants. So watch for the book soon. Some of you may have already received them. They've been in a number of them have been in the mail already. But there are a few who haven't responded to emails. So check your inbox if you received an email from us. We're waiting to get an address so we can ship these out to you. And you'll also get a follow-up email as well. So watch for those. You might be one of the lucky participants there. So now I'd like to turn it over to my colleague, Jason.
Thank you, Lance. I'm really honored to introduce Dr. Esther Sternberg. We've heard a lot about her, and we had a pleasure of meeting you earlier this year. Just to tell you a little bit about her, Dr. Sternberg is an internationally recognized design and health and mind-body science pioneer. She is a researcher, director at the Andrew Weil Center for Integrated Medicine, and founding director of the University of Arizona Institute on Place, Wellbeing, and Performance. She is also a research professor of medicine and science at the University of Arizona and holds joint appointments as professor of architecture and planning and landscape architecture. She is currently advising the National Science Foundation on Wellbeing in the Built Environment and the International Well Building Institute's Task Force on COVID-19. And she is, in addition, the co-chair of the IWBI's Health Equity Standard Advisory. Dr. Sternberg has authored over 235 articles, edited 10 technical books, advises on national and international councils and committees, and authors 2 popular books. One, The Balance Within, The Science Connecting Health and Emotions, and her best-selling book, the one we'll talk a little bit about today, Healing Spaces, A Science of Place and Wellbeing. These are just a few of her many accomplishments, but in the interest of time, we want to hear directly from Dr. Sternberg. Esther, thank you so much for being here. I know you're really busy, especially as we kind of enter back from COVID, and the work you do and the research you do plays a key role in our recovery and our wellness and coming back. So thank you for taking the time today.
Well, it's a pleasure to be here. Thank you for inviting me.
Great. Let's just I just want to really jump into the content. And this topic is really dear to us. When the pandemic started last year and quarantine started, we started the Fireside Chat series. And that was like a moment for us to come out of our comfort zone and try something. But in a way, doing these chats has been a form of healing for us, and hopefully for our registrants and people who watch and attend and our clients. So it's been really good for us. So I'm really excited about this topic in particular. But maybe for you, on the notion of healing spaces, those who have not read your book, can you provide us with a kind of overview of the central premise of the book.
Well, so first of all, thank you for that very gracious introduction. And I do want to say that this whole experience through COVID and the ability to do something to help has been very healing for me. And I think that that's the message that I would send to design professionals. What you do is front and center at the beginning of the pandemic, the spread of the virus, mitigating indoor environments to reduce the spread, and now creating environments that will help reduce stress. So, kudos to all of you on the front lines of the design professions. And I guess the premise of the book is that we health professionals cannot do it on our own. We need to work with you, the design professionals, to create a healthy, healing world that is both healthy and healing for physical health and emotional well-being. And I think at the beginning of the pandemic, the focus, as it should be, was on physical health. I mean, obviously, preventing the spread, ventilation, and so on. As we emerge, there's a recognition that there has been a worldwide mental health crisis in the wake of this pandemic, from the isolation, from the fear, the stress, the anxiety of whether you're going to get sick, grief, loss of loved ones, loss of jobs, financial instability. So to the extent that one can design the built environment to help reduce those stresses that we can reduce, we can't reduce stress. Forget about it. Don't even try. And no single one of us can do a whole lot about the pandemic. Even if you're an immunobiologist and you're discovering antibodies and vaccines and so on, there's so many pieces to this that no one individual can do it all. But by the same token, each one of us can do our part in our worlds to help. And that to me has been very healing, to know that I can do that in my world and work with colleagues like you to help others. So I know that's not a summary of the book, but in many ways it is. So the book asks the question of how it is that the environment, the built environment, and the environment around you can impact your health and well-being. And when I say well-being, I mean emotional health. And it's structured, the first few chapters are about what you see and hear and smell and touch and do in a space, and how all of those things can impact your emotions that then impact your immune system to help your immune system do its job. And then I talk about healing world and taking it beyond the individual building to more of a city scale, and then the green environment. So it came in part out of my first book, The Balance Within, the Science Connecting Health and Emotions. I myself went through a period of extreme stress a couple of decades ago when I was a caregiver, long distance caregiver of my mother who was dying of breast cancer, and I had a number of other stresses in my life. And as a physician and scientist at the National Institutes of Health, I had been studying the role of the brain's stress center in autoimmune inflammatory diseases. I had discovered that the brain's stress center is important in susceptibility to these autoimmune inflammatory diseases like arthritis. And ironically, I went through this period of stress and myself developed inflammatory arthritis. And then coincidentally, when I moved into a new house, went with my new neighbors to their cottage in Crete. And I healed. I wouldn't say it was a miraculous healing, but it was pretty miraculous. And I asked the question, what was it about those surroundings in this beautiful Mediterranean island where I was swimming in the ocean every day, and I was climbing the hill above the village and sitting there for hours meditating. I didn't know I was meditating, but just listening to the birds and the sea and looking at the bougainvillea on the white stucco buildings. And what was it about that experience that helped me heal? So that's really what fed into this book, to ask, what is it about what you see and hear and smell and touch and do in a space, and eat, in fact, that helps you heal?
Great. And so I think you're absolutely right. You talk about at the beginning of the pandemic, it was we are worried about healthy buildings. What is it about the building functions? But I think when I read your book, I start to feel it's also what's within you. You're healing from the inside out.
That's
and so
right.
it's both directions, correct?
Yes, and that's actually the premise of my next book, is from the inside out.
Oh.
And
maybe we can hold this topic a little bit later, so we can.
Yeah.
I do want to talk about that. Let's dive deeper. So I attended a leadership event through the Chamber of Commerce in Las Vegas recently. It was a panel on mental health, and one of the notions they talked about, and it kind of stuck with me, is healing doesn't begin until one's rooted in place. And so I see a strong connection with what you're talking about in your experiences of when you connect to place, to the built environment, there's an opportunity for healing just to begin. So
that's a really, really interesting notion, because I actually do talk about this in the book, the role of when you study animals, it's called place preference. So there are you can actually learn to associate certain we humans and all animals can associate certain characteristics of a space with a given emotion. So if you've had a positive experience in a space, in a place, and all of the different elements, what you see and hear and smell and touch and do in the space can trigger those warm, positive feelings. It's a little bit like Proust's eating the cookie with the Madeleine with the tea. It evoked to him this comfort of childhood with his grandmother. And that can happen to everyone. And if we intentionally design the space to evoke positive emotions, that's where you designers come in. By the same token, a space can be stressful and can evoke negative emotions and can in turn prevent healing. So,
right.
Things are much better now in terms of healthcare design. But when I used to give, about 10 years ago, when I'd give a talk, I'd describe a space and I'd say, what comes to mind when you think of a maze where you can't find your way, foul odors, lots of noise, poor light, dim lighting, and everybody says, a hospital. Well, it shouldn't be that way. And fortunately now, thanks to you designers, hospitals are much, much better and are paying attention to the experience of the person in the building, the patient who's sick. Because, and I'll go back to what I was talking about before, my research at the National Institutes of Health, where I was for 27 years before coming to the University of Arizona 9 years ago. And what I studied was that connection between the brain and the immune system. And what happens when you're stressed? So we all know how we feel when we're stressed. Our heart beats fast and we get sweaty and we want to run to the bathroom and we feel anxious. That's your stress response. That's your stress response that's making you feel all those things. Your stress response is governed by stress hormones and nerve chemicals that are released from the brain and the adrenal glands. And cortisol is a big one. It's one of the most potent anti-inflammatory hormones that our body makes. So if you've ever had a poison ivy rash, or you have allergic rhinitis and you've used cortisone nose spray or cortisone cream, you know that cortisone is a very potent anti-inflammatory. Well, when you're stressed and you're pumping out that stress hormone, you're going to tune down your immune system's ability to fight infection. So it doesn't make sense to create a space like a hospital where people are already stressed, they're already sick. You don't want them to get infected, and you want to do everything possible to reduce the possibility of their own body contributing to this tendency to get infected. So to the extent that you can design the spaces to reduce stress, you'll help that person heal.
Yeah. Well, I really appreciate the depth you go into the how and why that occurs, or why that matters in your book. And I think some of us, we kind of are on the outside of it, we feel it, but you really dive deeper. And thank you for that. And I think you kind of answered the question of what led you to write your book. But also in your book, I noticed you, I appreciated how you included part of your research and the depth that you're providing is you reference a lot of researchers with diverse backgrounds and within your research. I wonder if you could talk a little bit about how important it is to have ethnic, age, gender diversity within research, and how that plays in. Why is that important to you?
Well, so it's essential to have diverse points of view. Let's start with the simplest, the points of view of your knowledge or expertise. What is obvious to me in my field of medicine is not obvious to you in your field of design. And likewise, what's obvious to you in design is not obvious to me. And to bring these two ways of looking at problems together to create solutions is, I've always found it much more productive to work on the boundary of multiple disciplines. So engineering, architecture, science, medicine, psychology, so on. So if we step back then and say, it's not only your knowledge that you bring to a problem, but your life experience that you bring to a problem, your culture, your ethnicity, your gender, your age, all of that gives you a particular point of view, which is different from another person's point of view. And bringing them all together can really help to solve problems that otherwise might appear to be very difficult to solve. So, people have said that it's clear when they read my book that I'm a woman. Well, duh, I write from my point of view and from my life experience, and the examples I give are my own examples of the stress of being a caregiver, or it helps to illustrate the points in the book, but it nonetheless comes from my own experience.
Yeah, and I agree wholeheartedly. As designers, I mean, part of our task is to solve problems, and I can only approach a problem from my own experiences. And I love how you leverage all the different expertises and viewpoints in the world to add to it. And we're not going to be able to solve the world's problems until we start doing that. Start broadening the perspective and the approach and the solution. So let's dive a little bit more into some of the central themes of the book. And one is, you already talked a little bit about it, but maybe you can talk a little bit how it actually works. This notion of how reducing stress and anxiety provides self-healing.
So as I mentioned, when you're stressed, your brain starts pumping out these adrenaline-like nerve chemicals and hormones that ultimately result in the adrenal glands pumping out adrenaline and cortisol. And those chemicals, those molecules, those hormones directly affect how immune cells can function. So, when you're exposed to a virus, let's talk about a virus, there is a whole sequence of events of different immune cells that come to the fore to fight off that virus. And cortisol, the stress hormone, tunes down the ability of all of those different kinds of immune cells to do their job. And there's a wealth of literature showing that people who are chronically stressed, for example, chronic caregivers of Alzheimer's patients, or people going through divorce. This is Janke Koch-Glaser and Ron Glaser. I won't mention all the names of the people who've done this, the Sheldon Cohen. These are the sort of the pioneers in the field who've shown that chronic stress reduces the ability of the body to fight infection and to heal. So people who are chronically stressed have more frequent and more severe viral infections. They go out to get a flu shot. They have a lower take rate of that flu shot because their body can't make the antibodies effectively. If they're chronically stressed, there's prolonged wound healing. There's slowing of, there's speeding of chromosomal aging. So your chromosomes shorten as you age, and you can predict a person's age by measuring the length of the ends of chromosomes called telomeres. It's kind of like a shoelace that frays as it gets old. So chronic stress will speed that chromosomal shortening by 10 to 17 years. Wow. If you're chronically stressed, you can look 10 to 17 years older than your biological age. That's something I wouldn't want at my age. And maybe younger people don't mind it, but and then there's certain kinds of cancers chronic stress will speed cancer growth. So, and there are studies of the reverse, that if you engage in a lifestyle change, and this is what we call integrative health or integrative medicine. Actually, Dr. Andrew Weil coined that term maybe 30 years ago. It's not complementary and alternative medicine. It's not throwing out the baby with the bathwater. It's saying, yes, we'll use the space age drugs and surgeries and technologies that we have to help us heal, but at the same time, help your body do its best to heal by reducing the stress, removing those negative stress hormones, and allowing the body to do its own healing. So there are studies that show that this kind of integrative intervention, which is 30 minutes of walking a day, a healthy Mediterranean diet, and we can talk about what that is later, and mindfulness meditation, 30 minutes or some period every couple of days, will allow your body to heal. And it doesn't matter when you start engaging in this activity. So you could say, oh, I've been a couch potato for 40 years and it's hopeless, forget about it. Well, it doesn't matter. You can always reverse that chromosomal aging by starting this kind of healthy lifestyle. And I want to make one other point about this, that telling people to reduce their stress, that doesn't work. You know, if you're stressed and I tell you, well, just stop feeling stressed, that's not going to work. That's even going to make you more stressed. So there are many ways to engage in these healthy lifestyles, to find ways to reduce your stress. It's important to find a professional who can help coach you in this or lead you through whatever the particular issue that you have is. And I can tell you that the psychologists on our team and the therapists have been overwhelmed with the numbers of requests through COVID of people who ordinarily would not seek help, but seek help if you need to. It's just like, you know, an Olympic athlete, if you have a coach to help you be, exercise optimally, train optimally. And it's the same thing with mental health. If you can't do it on your own, seek help.
Well, thank you for that. And it gives me hope to hear that there's a way to reverse aging chromosomes as we all continue to get older. Maybe we talked about this idea before, and you mentioned earlier that you cannot remove stress completely. That's impossible. Things happen. There's events that happen. And even on the other side of that, as designers, we're interested in building experiences, building peak experiences. And sometimes we do that by contrast or a surprise, a wow, which in some ways could consider maybe raising stress at certain levels, but it's a stress that people sometimes seek out, and it's more of a thrill or the unexpected. So can you talk a little bit about having a healthy balance?
So the stress response is essential for life. So there's a couple of things. The word stress is what everybody thinks about when you feel anxious and stressed and the bad thing that happens to you. But the physiological stress response, all those nerve chemicals and hormones that get triggered that make you feel the way you feel when you're stressed, that stress response is essential for life. It gives you focused attention, vigilance, the ability and the energy to fight or flee, so the fight or flight response. And if you can imagine, if you were a mouse in a field and you didn't have a stress response and you just slept when the cat came along, you'd get eaten right away, right? So you need that, and there have been studies, genetic studies of, from a fruit fly to a fish, a mouse, a cat, a rat, a human, everything in between has to have a physiological stress response in order to survive. The trick is not to get rid of that stress response. So when you are completely relaxed and you're lying down, you're dozing off, you're at the beach, or you're thinking you're at the beach and you're half asleep, your stress response is very low. In order for me to perform here, my stress response has to be turned on to optimal. So if you can imagine a rainbow, sort of here, a rainbow. On the left-hand side, there, I'd be lying down, I'd be thinking I'm at the beach, I'd be calm, my stress response would be low, you would be stressed, and your audience would be bored. So I have to get my stress response up to the middle of the rainbow to perform at peak. The problem becomes if that stress response falls over the edge of the other side of the rainbow, that's when your performance fails. And that's when you freeze. And that's when you're too anxious to do your job. And so the trick is to find ways to move your stress response back to the middle of that optimal performance for the task at hand. You may want, when you're at a spa, of course you want to be lying down half asleep, that's great, but not when you're on deadline on an architecture project, and that's not so good. So that's where these kinds of integrative interventions can help. Meditation, Tai Chi, yoga, exercise, gentle exercise. You don't have to get on a treadmill and go 90% VO2 max. Take a walk around outside, look at nature. Nature is very helpful to reduce your stress response. And so to tweak it, to move it back to the middle is really what you want to do.
Oh, thank you, because it makes a lot of sense. And knowing when you go past the middle, I feel like there's a downside to that. Like you may perform for a little bit, but then eventually performance and ability to handle situations go down.
Exactly.
Lance, do you have a question?
I do, because one popped up and somebody asked something, and it's kind of in context here. So Colin is actually asking, can you address some of the research around Japanese tradition of, I think it's called Shinrin Yoki?
Yes,
or forest bathing?
Forest bathing, yes.
Yeah, and how that plays into the design and function of urban spaces, in particular desert environments.
Well, so yes, it's a great, this forest bathing is a tradition in Japan where you go into the forest, and I think the thinking is that there's something that you absorb, or there's that helps you heal or be well. But really, when you think about it in the scientific context, again, it's what you see and hear and smell and touch and do. So you're walking slowly, you're inhaling deeply, you're inhaling the scents of the forest, the fresh air, you're cool, you're at a temperature and humidity that's comfortable, you're looking at beautiful views and looking at nature. And all of these things trigger what is called the relaxation response. So there is a stress response that turns you on and revs you up. and there is a relaxation response that puts a brake on that stress response. And the relaxation response is governed by the vagus nerve. So if you've ever been punched in the solar plexus or in the stomach and you pass out, hopefully not, but the reason you pass out is your vagus nerve is really concentrated around there, and it slows the heart to the extent that the heart slows and you pass out. So the vagus nerve, when it's activated by deep breathing, so if we all, so I see there's a number of people on the chat, and let's all sit up in our chair and let's close our eyes and let's just take a deep breath in and then exhale. So right now, if you're wearing one of your little wearable devices, which I am here, you would be able to see that your heart rate slowed right away in response to that deep breath. I've done this with my blood pressure. Blood pressure comes right down when you do that. And that's because you're triggering your vagus nerve. Your vagus nerve innervates the diaphragm, and when you do deep diaphragmatic breathing, that triggers that relaxation response. Other things that trigger the relaxation response are walking slowly. So there's your forest bathing, inhaling deeply, as I said, and looking at beautiful views, looking at nature. We don't know exactly why it is that across all cultures, ages, educational levels, gender, ethnicity, people prefer beautiful views, vistas, nature, views of nature to belching smokestacks. I actually showed a picture of a grove of trees and a brick wall. This is from the landmark study by in 1984 in Science magazine, showing that people healed faster if they had a view of a grove of trees versus a brick wall. And I showed these two pictures, and I said to the audience, how many of you prefer the grove of trees? And everybody said they prefer that, but one person in the audience said he liked the brick wall because he was an architect. I think he was kidding.
I think he's given architects a bad name right there.
I think but anyway, we don't know why. It turns out that there's a part of the brain that recognizes beautiful views, and it happens to be rich in endorphins, those feel-good molecules that are anti-pain. And then there are other parts of the brain that light up when you're looking at beautiful views that are part of the dopamine reward pathways. So there are many different ways to counter the stress response by engaging in these activities. So thank you. That forest bathing is an excellent example.
Yeah, thank you for answering that. I want to talk a little bit about senses and how the senses tie into healing. It's, when I mentioned we were, as architects, we're into experience design, and we know tying to the senses creates better experiences. Not the scientific experiences, but maybe the qualitative experiences, which I guess what you're proving is actually part of the scientific healing. So I'm glad to hear that connection, and how senses can also trigger past experiences or past memories, and how that can even heighten the ability to for the body to actually heal itself.
Yes. So again, and the sense of smell is a very powerful one that triggers emotions and memories that can either be positive or negative. But and so when we think about smell, there are certain. So smell is really their odor molecules are actually chemicals that when they come into the nose, they're actually affecting you in a chemical way. So there are certain scents, natural oils like lavender, that is calming. And people have done studies in anesthetized rats, and anesthetized rats that inhale lavender will go into deep, slow wave sleep. It's not because the rats know something about lavender, it's that it's a chemical that makes you sleep. But the other part about scents and fragrances is that they can trigger emotions based on your own personal experience. So if you used to go to the beach as a child and you had positive associations with that, when you smell the sea air, that can bring on positive emotions. I mean, I think the hospitality industry knows this very well, because they have, pump odors into the lobby, and you feel right away you're at a mountain spa or at a beach, and without even realizing it, you feel good. In the book, and I hate to bring this up with design professionals, but I do talk about Disney and his Imagineers, and I describe Pirates of the Caribbean and how they so cleverly designed that ride, in fact, all of the rides, to take advantage of all of your senses and give you subconscious cues that something is not quite right when you hear the banjo player playing off tune, for example, and then right afterwards you have a drop in that, drop into the pirate cave, and that triggers your stress response consciously. So, you can manipulate people's, well, I think they do this in Las Vegas too.
Yeah. No, absolutely. I think designers of any built environment can learn a lot from hospitality and even themed entertainers like Disney. And we actually look at that for inspiration on creating better experiences. So
Right.
Thank you for mentioning that. So I'm going to keep going, and maybe you can talk a little bit about, you talk about this notion of belief and the power of the mind, and how that expectation can, or the mood, and you mentioned this a little bit, how you can work on getting a better mood through meditation or other sources, but maybe talk a little bit about that, how the mind is healing, or how that can provide healing experiences.
So there is a belief response. So unfortunately, it's called the placebo response. And placebo has a very bad rap, and it's usually preceded by the word just. Oh, it's just the placebo response. Well, the placebo response is the body's own ability to heal. And if you get away from, faking the, giving people something that they think is real and it's not, but if you just think about that belief response, there are studies, brain imaging studies in devout nuns who are praying or visualizing or counting the rosary, in monks who are chanting, and it's very clear that there are parts of the brain that become active when you're engaged in these activities, which are, again, rich in endorphins, rich in those anti-pain feel-good molecules, and rich in dopamine, the dopamine reward pathways. And so those kinds of experiences and activities can certainly counter the stress response. I did a panel, I moderated a panel with the Dalai Lama a number of years ago, and the panel was about using meditation to reduce stress and help autoimmune inflammatory diseases. And just before the panel, his translator, the Dalai Lama's translator, told me I can't use the word stress. And I said, how can I do a panel about stress and not use the word stress? And why can't I do that? And he said, well, it's because stress is not a word in the Tibetan tradition. They have dukkha, which is angst, really, which is depression or angst, but they didn't have the word stress. So I got stressed, and I decided I better deal with this head on, and I started the panel by asking the Dalai Lama whether he uses meditation to reduce stress, and he said no, and he didn't want to say anything. He was completely silent, and then I said, well, what do you use meditation for? And he says, oh, simple, one word, love, to enhance compassion. And so from the brain's point of view, if you sit there and you're meditating and you're saying, I want to reduce my stress, I want to reduce my stress, you're not going to reduce your stress. If you are meditating and you're enhancing compassion and love, that is going to trigger all those brain pathways and nerve hormones that are positive with the dopamine reward pathways and that reduce stress in the course of enhancing the positive. So I think that's a long answer to your short question.
Well, that's actually amazing. I mean, the world would be a lot better if we all showed compassion. And
yes,
you're making a connection. Compassion is actually self-healing. And
it is. I want to make sure that we talk about space and architecture because I don't know how much longer we have.
Well, we're going to get right there. I think, Lance, you have a question, and then, of course, we're going to look at other connections to the built environment.
Yeah, just a quick question. Kelvin's asking, out of all the senses, is there any one that's more important when it comes to healing? Are they all equal, or is there something you can focus on more for better healing?
That's a really great question. And so it's much better to have all of the above. And I think that's why forest washing is so beneficial, because you're experiencing all of the senses. People have asked me, can you just look at a beautiful view, a picture, if you don't have a window, if you don't have a beautiful view, can you? And actually there are studies, Professor Sean McCann in Ireland, who runs the bone marrow transplant unit there, or at least ran it until recently, until he retired. The view out the window was just the HVAC equipment, because it was a 200-year-old Dickensian workhouse that had been converted. And so he projected on the wall of the patient's rooms with using an LCD projector, art and beautiful views and sort of cows grazing and horses grazing and so on. And he found that at the end of the 8 weeks of this bone marrow transplant patient stuck in that one room, they did have a much better quality of life and better mood. So you can do one thing if that's all you can do. It's much better to have all of the above.
Great, thank you.
Great. So I think to your notion, Esther, let's talk a little bit more about your current research, because I think that starts to tie in. You showed, and this is related to a question that we have too, is you showed a device earlier and you're taking measurements on human responses to the built environment, and particularly in, I think, office spaces now.
Yes.
You want to jump to that and talk
so
a little
I
bit more deeply.
Started working when I was at the National Institutes of Health about 21 years ago. I started working with Kevin Campshire, who at the time was Director of Research for the General Services Administration, and he's now Director of High Performance Federal Green Buildings for the GSA. And he came to me at NIH as a sister agency and asked, is there a way that we can measure the impact of the over 300 million square feet of office space that that the GSA owns and operates, and there are over 1 million office workers. Is there a way to measure the impact of that built space on people's health and well-being in a quantitative way, so that he could design and operate his spaces so that people's health and well-being were optimal? And so we began back then using wearable devices to measure the impact of the built environment on the stress response, on physical activity. When I moved to the University of Arizona, we shifted to state-of-the-art devices, looking at physical activity, posture, stress response, and sleep quality, and the impact of up to 11 different environmental attributes on those different health outcomes. And there is no question that the built environment has a huge impact on all of those aspects of health. So it's important to think health is not one thing. Health is not even a thing. It's a process. It's a verb. Health is not a noun. It's a verb. And the environment contains so many different variables that at every moment of the day is impacting every aspect of your health and well-being. And it's hard to tease all this apart, but what we found is that we could, using big data analytics and these wearable devices and continuous tracking of environmental variables like sound and light and also office layout, we were able to tease apart the ways in which these different elements of the built environment impact different aspects of health. And so it provides a kind of, it's a prescription for how to design a building to optimize the health and well-being of the people in the building.
Wow, where are the findings where we can findings from the research?
Yeah, so we have a number of papers that have come out. The study was called Well Built for Well-being, and it involved researchers at the University of Arizona, at Baylor College of Medicine. Aclima is a company in the Bay Area that did all the real-time environmental monitoring of these 11 different environmental attributes. And then, of course, the GSA team, Kevin Kampshire, Judy Heerwagen, Brian Gilligan, and others. So it was, we studied 4 federal buildings and 270 or more federal workers. We did a follow-on study with IARPA, which is the intelligence community's DARPA, and Lockheed Martin, and we did a similar kind of study with them in a Lockheed building. And so you can do these studies and come out with information that informs the design of the office space and the temperature and humidity and sound that's optimal, and light is very important. So I mean, to segue from that to what I really want to focus on is how do you take that information and create a space that supports integrative health. Mm-hmm. So we have a paper that's in review, it should be coming out soon, that lays all this out, and that you can think about there are 7 domains of integrative health that that support both physical health and emotional well-being. So, and for people who want to look at this in real with a visual, the Andrew Weil Center for Integrative Medicine created an app called the My Wellness Coach app, and I can send you the link afterwards. And it takes people through the 7 domains of integrative health to help you find your sort of balance of health and well-being. And those 7 domains are sleep, resilience, which is really the stress response, the stress and relaxation response, the environment, movement, relationships, spirituality, and nutrition. And if you think of those 7 domains, and the image of the My Wellness Coach app is like a daisy, it's like those circles overlapping. You can design, as designers, you can design to each of those elements. So starting with sleep, let's say. Light, circadian light is extremely important. Between 8 a.m. and noon, bright sunlight is very important for enhancing sleep. Reducing stress is important for enhancing sleep. Increasing physical activity is important for enhancing sleep. You can design spaces to increase physical activity. Beautiful stairways, navigation around, well, open office. One of the things we found in our studies with the GSA is that open office design, which people hate, is that people in open office design were 32% more active than people in private offices, and 20% more active than people in cubicles, and it amounted to 1,000 steps more a day. You can mitigate the negative aspects of, and when I say open office design, it's not just open office, it's really active office design. It's having lots of choices of spaces to go to. Right. And you can mitigate the noise problem. Noise, there's no question, is a stressor, but there are technologies to mitigate noise. And I visited an office space, Green Mountain Power in Vermont, which services all of the entire electrical grid of Vermont. is in this, what used to be a warehouse, and it's all this open office, lots of choices, active design. And they very cleverly put skylights in to bring in the circadian light. And even in the call center, they have rubber flooring and baffles on the ceiling to direct the sound. I mean, anybody who's been in a recording studio knows that you can really manipulate the sound to minimize the noise. So there are ways to design to enhance movement. Relationships is important, spaces for social interactions. Now that's a bit of a problem now, and we can talk about that post-COVID. Spaces for spirituality, to have peace and quiet and to meditate or contemplate. And then healthy nutrition, access to healthy food. So you can design to all of these elements of integrative health.
Well, thank you for that insight, and we'll definitely, I'll get that information for you. And when we send the email out to those who registered, we'll definitely include that as for everyone's use. There was a question, the device you showed out that measures heart rate. What are the measurements?
I don't want to, I don't want to name the name. I don't want to be promoting any one device.
Okay.
I happen to use this one. It's a ring. You see it, and you can sort of see the electrodes in it. But you can, your watches, your Apple Watch, your Garmin, your Fitbit, they all do heart rate variability, sleep quality, stress response. They're all based on your heart and your heart rate. That's how they calculate everything. And also your physical activity and your posture. We're working now with the Air Force Research Labs and other consortium of industry to develop ways to measure immune molecules in sweat and other molecules. And the next wave of wearable devices will be based on wearables to measure molecules in sweat. But that's
wow. Well, it seems like there's a benefit for organizations and their employees to invest in this, and because I think that comes eventually down to performance, bottom line, or other factors.
Yes.
Companies.
Yeah, I mean, the notion that you design a building and not care about how the people in it are feeling, I think that's so 20th century. It's essential to optimize the health and well-being of the people in the building, and it's good for your bottom line. It's good for retention. The studies have been done in healthcare design with Robert Wood Johnson Foundation and the Center for Health Care Design. They did a project called the Pebble Project, where they looked at the impact of designing different hospital wings to include these kinds of elements. And they found a significant improvement in health outcomes, but also in patient satisfaction, in nursing and staff satisfaction, less staff turnover when they designed to optimize for health and well-being of the people in the building. So it's what's good for the health is good for the bottom line.
Yeah, absolutely. And as like our office just moved back June 1st, and I know other organizations, and we have a lot of nonprofits on the call today, and their employees, the people that work in those environments, are already a level. So I think you want to talk a little bit more about that. How what can some of these employers, nonprofits, designers, what's some things that they need to look out for? I mean, you talked a lot about all of it, but there's some
well, I think
maybe clear examples of what they can do.
Post-COVID, we're all building the airplane as we fly it. We're just learning. So, for example, I mean, the biggest question is, why do you need the office? What is it in your organization? I think the biggest question is for organizations to really explore with everyone. What is it that you gain by being in the office? And what is it that you can do better at home? And it's going to be different for different people and different age groups. And but I think the idea of flex time and flexibility of location and Zoom. I mean, I couldn't have done this fireside chat with you without Zoom, right?
Right.
So there's an advantage. But you know, when you're together, there's definitely an impact of teaming, of social support. And then the question is, how do you balance not being too close to people, but being close enough? And of course, it's going to require at the same time thinking about the ventilation and having what is the maximal occupancy based on the ventilation rates for the given space. So, you know, we can't only think about designing for well-being. We have to think about the physical aspects of the space. Temperature and humidity is an important one. The drier it is, we're dry here in Tucson. And the drier it is, there are studies showing that viral infections increase when it's particularly dry. We found in our studies with the GSA that the optimal humidity, relative humidity, is around is between 30 and 60%, which is ASHRAE's range. And optimal for stress response is 45% plus or minus 5%. Really hard and expensive to keep the humidity at those levels, but less than 30% is not good for you. So I think ultimately the future of design is going to be individualized spaces. We have a researcher here at the University of Arizona, the College of Architecture, Dr. Alethea Ida, who's working with bioresponsive materials to create furniture and wall coverings that optimize temperature and humidity for individual spaces. We didn't talk about carbon dioxide. When you're exhaling carbon dioxide, the more people in a room, the higher the levels of carbon dioxide, the poorer the ventilation, the longer they're there. Then, you know, high levels of carbon dioxide, you get fatigued, you fall asleep, you make errors, your cognitive performance fails. So the ventilation is important. So, you know, local fans can help. So different elements of space that are individualized can help optimize individual comfort and experience.
Great. Lance, I know I think, feel like us, or we can go on forever because the content is so great. But Lance, do you have a few more questions?
I did have one, but you did a great job answering it. Craig was asking a similar question of what could we do, right, as people start coming back into the office, and what should designers look out for? And you did a great job answering exactly that.
I do want to add one thing about, because at the beginning of COVID, everybody said, oh, this is the death of open office design. On the contrary, no, open office design is much better because you can distance when you need to distance, you can have better ventilation and larger spaces, and then come together when you don't need to distance. So it's much worse to sit two people in a small office, private office, breathing on each other. So I think that it's going to be a work in progress, and and you as designers with your clients, that's something that you can do. Explore with them, what is it that you really need the office for, and how can we design to that?
That's great, because that's a refreshing take on open office design, because I remember the sociology of the closed office and moving to open office, and how the collaboration, the opportunities to collaborate different ways, and the benefits open office. And we heard designers heard a lot last year about how that's bad. It's bad for COVID, it's bad for virus. But I like to hear the opposite argument, that there's always going to be a place for that.
And again, it's not open office. It's really what they called mid-century, I think, active office. Lots of choices.
Right.
Lots of
Yeah. Thank you.
And space, because offices were getting tight, right? People were getting very close to each other.
Exactly. Yes, exactly. And that was the cubicle thing. You know, squeeze as many people in as possible. Well, that's not a good idea.
Great.
Wonderful.
So, I just have one more question, or do you have another one, Lance?
No, I believe that's it.
Okay, maybe Esther, I know you're a person who always asks tough questions, and so what's next for you? Maybe you can give a small talk about your next endeavor with your healing within.
Well, so I am writing another book, and that's coming out sometime next year. And in terms of the research, we're continuing with wearable devices. We've also pivoted actually to creating a dashboard to really, we're calling it Dash Safe, Dash Well. It's a way of emotion mapping in space, where people feel comfortable, where they feel safe, where they don't feel safe. And so we're really working on that, trying to
Wow.
get away from actually having to touch the people. We pivoted during COVID because we couldn't do wearable studies anymore. And so we're working on that. And I'm a big believer that technology can provide a lot of solutions for individualized, optimal spaces. I mean, if you, in a science fiction kind of world, if you could imagine, you remember Get Smart? You remember that movie and TV show, and he has the cone of silence coming down. Well, if you could imagine the cone of perfect environment that you're surrounded, you can do surround sound, you can do your local temperature and humidity, you could, so it would be really futuristic, but a way of thinking about designing individual optimal physical and emotional health.
Wow. I love that reference, and you're right. The technology growing, and you've already shown you can get readings from a Ring or other devices. It's amazing. So I'm looking forward to reading more, understanding more of what the work you're working on. So Esther, thank you very much for taking the time today. I hope everyone received the same amount of joy out of listening to you as I have. So thank you very much.
Thank you so much. I really appreciate it. It's been a pleasure talking to you, and look forward to continuing our conversations.
Yeah, thank you.
Thank you,
Lance,
Esther.
you want to talk about next one? Yeah.
Yeah, I just want to remind everybody we're working on our next Fireside Chat. Will be in August, and very soon we'll be sending out emails to everybody and posting it on our social media, so watch for it there. So just want to say thank you, Esther, and thank you everybody for joining us this evening, and have a wonderful rest of your day.
Thank you.
Thank you very much.